So, welcome everyone to Now Written Live. I am Ashish Rishi, CEO and founder of Unwritten Health. Now, today's topic is a very interesting one, and I have a really fascinating guest. But really, I want to start with every company in our space. They say they want to hear from patients. And I got to be honest, I believe most of them mean it, but meaning it and building a system that actually allows it are two very different things. Now, I have known Robert for a while now. We've worked together on a couple of things over the years, but every single time, without fail, he has taught me something. And he is one of those people who just makes you think differently just by being in the conversation. Robert lives with a number of different conditions. He wanted to contribute his expertise as a patient to research. Sounds fairly incongruous, but the system told him that if he did, he would lose his income. So what is really inspiring about Robert is he then set about with some of his colleagues to change the law, and he did in Ireland, and now he's trying to do the same across EU. So Robert, welcome to Now Written Live. Do you mind just introducing yourself, please?
Yeah, so just a little bit of background about who I am. University educated, I came from a pretty privileged background, to be quite honest. I had really good education when I was young. I came from a family that was quite well off. So I came from a lot of privilege, but that didn't mean that when I learned that I had multiple sclerosis, which I was diagnosed with at a young age, 23, and I'm now 57, that didn't impact me in a very great way. And it actually totally changed the way my life was. And I was born at a very young age, had asthma, and I continue to have that. But I also have contracted two other things, sarcoidosis, which mainly affects my lungs, and chronic pain. And the reason why that became significant is I was on a wonderful medication called low-dose naltrexone, which is an off-patent medication for multiple sclerosis, off-label prescription, and has no patents on it. It's well past its restrictive phase. And I had tried very unsuccessfully to get a trial done on that 20 years ago. Anyway, I was on this drug and I was in a car accident in 2014, and it brought back my multiple sclerosis because I was symptom-free for 10 years. And my mobility started to be impacted, and my fatigue came back again. My sensory problems, I had them, problems with bowel and bladder. And, you know, when you have a chronic illness, it impacts you. But when you have multiple of them, what happens is they conflict with each other. What you need as a medication for one, you can't take it as a medication for another. For example, vitamin D. Vitamin D is great for multiple sclerosis, but for sarcoidosis, not so good. It can actually work again. So that's kind of where I am. I think as a person, I look at the world in a slightly different way. I see problems, or I see things that are obstacles, and I want to find a solution. I hate to see that being an obstacle. That's what brought me into business and brought me a little bit into being a management consultant. I did that for a while for small businesses. So that's a little bit about my background.
No, that's fascinating, and I think the way you described it is you see the problems and you try and tackle it. I think that's the key skill set to have, and we need more like that in this industry, I think. So if you don't mind, do you mind just telling us a bit about what your day-to-day life looks like? And you have a really interesting blog called The 30-Minute Life, but what does that mean in practice?
One of the implications of that car accident is that I'm in constant pain as a result of it. Now, it was a whiplash injury, so it was a trivial accident. It was like a really low speed. I was stopped. Somebody just bumped into the back of me, but however I was sitting in the driver's seat, my head went back. I heard this loud crack in my neck. And since then, I've constant pain in this side of my head, okay? And it's always there. And often when you talk to doctors, they ask, what is the pain level? My pain level here is at a level 5 out of 10. right? From the minute I wake up every single day. And I learned to manage that. I tried many medications, nothing actually worked for it. But what I found was that if I concentrated on anything for more than 30 minutes, that pain went into a whole other category of hurt. So it went to an 8, sometimes to a 9 out of 10, the pain as a result of that. And that was extremely, and is still extremely debilitating. And that's why I named my blog A 30-Minute Life, because I have to really manage my time so that I don't put that pain into orbit. And this is part of my coping mechanism. I've learned that that's the best way of doing it. 30 minutes, a hard stop. Now, there are times when I will, like I met you this year at the POF conference in Sevilla. That was 3 days of intense go, go, go. The pain medications that I was taking during that event, you don't want to know about it. You know, the only way that I could control it is having those extra pain medications. I suffer from fatigue, which I needed to have extra stimulants to keep me going. And that takes a huge toll on your body, as well as the fact that I'm dealing with multiple sclerosis, which doesn't like fatigue, which doesn't like stress, which doesn't like change. So literally, I'm just now, that event was nearly a month and a half ago now, and I'm just recovering from the event now. So that is how my life is. And I just thought writing that blog, or actually, I won't take any compliments on starting it. It was my wife, who was my girlfriend at the time. She said, Robert, you have to write about this. And I started that in 2017. And it logged how I had to live, the things that I had to do, changes in diet and behavior, but also that was the transition of my life from being in the working world. And before, when I was doing my business thing, I used to use my brain. That was my skill set. I was able to do the spreadsheets, the accounts, the taxation, all of those things. And I could deal with multiple issues at the same time, finding a way that they could knit together to maybe come up with a solution. But because of this pain, my ability to read a room was less. My ability to get into that flow state that you get when you're writing something or you're trying to create a problem, I had a 30-minute limit. And then I'd have to start again and start again and start again after taking the needed break after that. So I couldn't use my brain anymore. So I went and was doing market research, and I was knocking on doors. I was that person that said, can you give me 10 minutes of your time? And I have to say, I really enjoyed that. The stories that I heard were just really fantastic. But my body was letting me down and my legs stopped working. And I remember one day, and it was about 2018, late 2018, I was looking at a doorway to a house, and there was a slight slope up to get to that doorway. And I wasn't going to be able to make it. I would not be able to walk those steps up to that doorway. And at that point, I had to make the decision. I can't do this anymore. So I had to stop work. I couldn't find work that my body had let me down. My head had let me down. So I was in a pretty bad stage at that point where everything had gone wrong. In a sense, I had the car accident. I was going through a divorce. I had financial problems. I had all sorts of everything. My mother was dying of breast cancer. So there was a whole load of issues all at the same time. And meanwhile, I couldn't do anything. And where could I get my purpose in my day? What was my thing? So I was really fortunate in 2019. I had, because of the blog, I had been writing stuff for the MS Ireland and being involved with their MSME blog, which is tremendously successful. And I saw in their newsletter that there was a trial for a new cognitive therapy. It was a feasibility study that they were looking for somebody to be the voice of the patient within the study. And I thought, I think I can do that. I can be that voice. I have enough experience of this illness to be able to make it a little bit better, I thought. So I applied, and there was 2 roles available, one as a research assistant and the other one to be a member of their patient advisory panel. So I applied for both. I was greedy, right? I said, something is going to land. And I was very fortunate. I got the job as the research assistant. That was, I think, the start of my life in this advocacy world, or patient involvement world.
And that I think maybe now is good to move into the sort of next section here, because you've talked about the financial difficulties and sort of the change that you were going through in your life, and then this I can never say invalidity pension situation. Do you mind just talking us through that? What is the rule? What did it mean in practice for someone like you? And how did you? What made you want to tackle it?
Was the situation is because of that car accident, okay, I had a claim in because of the injury that was caused to me, and that claim was settled at the beginning of 2022, okay, which was coming up to the end of the feasibility study that I was involved with. And because of the value of that settlement, which was for pain and suffering, I lost a part of my income, which was disability allowance, which was a social support fund. And I was getting paid for 1 day a week in the study, where I had moved from being a research assistant to an embedded patient researcher. But I was, in the last 6 months of that study, my only income was that 1 day a week that I was earning from that study, which was about 80 or 90 euros. Okay, so I wasn't getting any income. When that study finished in June of that year, I applied for invalidity pension, which in Ireland is for people who cannot work, don't have the capacity for work. And it is a payment of, it's about 250 euros a week at the moment. So I applied for that support, and I was awarded it because of my situation. And I thought, okay, that's fine. I will be able to continue my patient advocacy stuff. I'll be able to share my experience. Maybe I'll be able to do more things. But I read through the rules, and in the rules, it said you are not allowed to do any paid or voluntary work without express permission from the Department of Social Protection. So I thought, okay, that's fine. I can ask for permission. I know how to do that. So I emailed them and said, this is what I want to do. I was invited to speak for 10 minutes about patient involvement for health. One of the kind of academic groups in Ireland to do with health research. So I asked for the permission, and I got a letter back saying, yes, Robert, you have permission to do this, but now you are kind of saying that you're able to work, and your support is now open for renewal, and we may have to do a new medical assessment on you to see if you are still able to receive this payment. That is an awful letter to receive if your only income is going to be this social welfare payment. And they're effectively saying we could suspend that payment indefinitely until they decide whether I'm still entitled to it or not. And we know how slowly governments work and how slowly these organizations, I could have been 6 months without a payment, right? So I said, no way, I'm not taking this risk, because I can't live my life with this illness not knowing if I have an income. Like, that was really devastating. And I because of the work that I had been doing for the previous 4 years, I had connected with PPI Ignite, which is a tremendous organization funded by the Health Research Board in Ireland that is promoting patient and public involvement within academic circles in the country. We also have Advocacy, which is an organization that represents not only patients, but the pharma industry working together. And they're very much allied with UPATI, which is an organization that teaches patients how to, about the research process. And in my time when I was on the COB-MS study, I became a fellow of UPATI. I learned that. But when I went to Advocacy and I went to PPI Ignite to let them know that there was this rule, they said, no, that can't be the case. That's wrong. How could that be? We've never heard of this, Robert. And I said, I'm not surprised you haven't heard of it, because we're not allowed to tell you. We're not allowed to expose it to the world without permission. So, and most people, 99% of people, are not going to risk their payment by standing up and saying, well, I need to tell my story and I need to help improve the quality of our health system or our health research. They won't take that risk. Now, maybe I'm stupid, maybe I'm a little bit bloody-minded, but I think because of my background in the business world and having changed rules before, having seen how some people interpret a rule and then finding maybe there's another way of interpreting it in a different way that actually is supportive. So I thought, I can't let this stand. I can't let that continue, that we have a world where there's a group of patients who are not allowed to speak. Now, if you think about it, in Ireland, there are about 55,000 people on invalidity pension. That's about 1% of the population, okay? They're on disability allowance, which was the payment that I was on when I was part of the study. There are 172,000 people on that payment, which is about 3.5% of the population. There are two other payments, carers allowance, and there is illness benefit. Between all of those, you've got about 400,000 people who are on welfare payments. That's 8% of the population. And that 8% maybe cannot use their voice in health research. That's an awful thing to think about. And if you take it into a European context, that means that 36 million people are silenced. And I felt, okay, maybe I can do something in an Irish context. Maybe we can do something. Maybe we can get the rule changed. It took a while. It took several years. It took the support of the health service in Ireland, of PPI Ignite, of Advocacy, of Stacey Grealis, who's a great friend of mine, who's also on invalidity pension. And we worked together, and we got to speak to the right person in the Department of Social Protection. And it took time for them to get over the policy mind block. But eventually, in November of last year, we did it. We got the rule changed. And now people on invalidity pension, that 55,000 people, their voices can now be heard. And that was, for me, I was so delighted. And the trial that I was on, the COB-MS study, I was part of the application for the definitive trial. And in that, I made sure that we had space for 2 patient-embedded researchers in the study and have the funding for it. And one of those in the definitive study, which I'm on the trial steering committee, but I'm not on the day-to-day stuff. One of those is on invalidity pension. She is able to be involved in that research because of this rule change. And I can tell you that puts a hell of a smile on my face.
I mean, it just puts a smile on my face just hearing that you've managed to change the system, because I think I'm always about, we need to change the system. The system is the issue. And so there is someone like yourself who's changing it. And I believe you're now thinking of taking it into Europe. Is that your next phase or next step?
Absolutely. And I've started that effort now a couple of months ago. One of the great things is Ireland, as of the 1st of July, is president of the European Commission.
Mm.
And this is too big an opportunity to miss. Like my father, may he rest in peace, he said, opportunity comes to pass, not to pause. So you need to take the opportunity when it's there. You can't wait for it to happen again in another 12 or 20 years time, whenever that's going to be. So we had put together a whole proposal, but when we were at that conference, Mary Butler, who's the Minister for Health with special interest for mental health, was at that event, and I got to speak to her for an hour. And I got to present our proposal that we should get this on the agenda for what Ireland can show as a country what we have done.
Yeah.
A positive change within the country. Now, does this cost the country anything? Not €1, right? Will it benefit the country? Oh, absolutely, because we'll have better health policy, we'll have better health research, and even there may actually be a tax benefit from it, because if patients who should be paid for their expertise, if they do get paid, they will pay tax on that. And that is tax that is coming from money that's coming from Switzerland or from the United States or from France, wherever that pharmaceutical company is. So this is a positive contributor to society in all places, right? There's no negative involved. So I thought if Ireland could use this positive story, bring it to the European Union and say, we need to change this across the union. And when I shared my experience of this rule change, Norway, Denmark, Belgium, France, Spain, Australia, Canada, all people from all of these countries were emailing me saying, Robert, we can't believe that you got this done. We have this problem in Ireland. Can we use you as an example? Wow. And so it's ubiquitous. And it's because these systems were designed in a time well before we even thought of involving the patient in research. And they haven't been changed. And it's because those voices were kept silenced. They've been excluded. And now think of it, 8% of the population are being excluded. Possibly, we definitely know 1% from the point of view of invalidity pension. We definitely know 1% from people illness benefit. That's definitely 2% excluded, not to mention all the others. Okay.
Yeah.
I think this is a tremendous opportunity. So I'm taking on the challenge. I don't know whether I will succeed or not. Okay. But when I speak to industry, when I speak to the organizations that represent patients, they all want this to happen. 100%. We just need government to take on what they have promised us in their signing of WHO and WHA agreements on the rights of people with disabilities. These have been signed by our countries, and now they need to put their money where their mouth is and say, okay, do this thing. It won't cost you a single euro. But from a societal point of view, the change that it will make, it will build trust between a patient community that feels like they are neglected, ostracized, and unwanted. And suddenly the government is saying, no, we want you. We are going to take active steps to make it easier for you to be included.
Sounds like a win-win, doesn't it?
It has to be done, Ashish. It has to be done.
Yeah, and it will. So is there anything that, so anyone who's listening, how can we support you and the campaign? Is there anything we can do to help?
Well, to me, there's two aspects of this. You've got the push and the pull, right? And this is where, if you have a relationship with your member of the European Parliament, you send them the letter and say, look, this is a problem. We need to get this changed. Really, I should draft up a template letter that but I'm just one person, right? I don't have a bevy of people behind me to support an initiative like this. I don't have the resources. I'm living on 250 euros a week. That's,
I understand.
I don't have those resources, but there are those who do, right? And if we can get people to support this initiative by sending letters to their MEPs, to their local members of parliament, that also needs to happen, because you need it coming from the countries as well as Europe pushing it down. And also speak to your patient advocacy groups. Ask them, say, look, I'm not being allowed. You need to do something about this. Because I think most of them don't realize it's an obstacle. They don't know that it's there. It's kind of on the periphery. It's kind of on the edge, but they don't realize that if you lose your income, or you could lose your housing support, or you could lose your medical rights because you spoke for 10 minutes at a conference. Talk about excluding a group of people. As just as much as I do, we need to have representative patients involved in health research. We cannot only have those who are independently wealthy or have an excellent pension to be the patient advocates, because they are not really representing the general population. They are, and this is why I mentioned at the very beginning of this, the privilege. I had that privilege at one stage. I had that private health insurance. I did not have to navigate the public system, but I do now. And so I know the difference. There is a vast difference between the two of them. And it is a challenge every day navigating healthcare. And, we're sick, and we're expected to manage something that a healthy person can find difficult, right? So I really feel that if we push our organizations, we push our public representatives, and then if we can get it on the other side, get the agenda coming from the European Commission, I think we can make change. And this is one of the things that we need more trust in our healthcare systems. And 100%. This is one way that we can practically actually build trust. And it shows that the industry, the hospitals, the government, they're there, they want to include us, and they're actually willing to take steps to make that happen.
Yeah, I think for me, I would like to get involved. I'll talk to you offline, but maybe I could help with a website or something or other. Maybe, I will definitely help, because I think it's important. And I don't know how does UK get involved in this? I don't know how it works with the EU and everything, but I'm sure the same laws have issues are in the UK as well.
It's ubiquitous, Ashish. And, it's in a different flavor in every country. It's slightly different. So definitely it wouldn't be a prescriptive rule change. It would be that nations need to support patient and public involvement in health research and policy, and not put any obstacles in their way because of the social welfare systems. It's very simple. It really is very simple. And I know that there are, maybe they'll think the tax people will say, but if you're able to work, we wouldn't have to pay the social welfare payment. But I've got a chronic incurable illness. I'm not going to get rid of this. Not today, not tomorrow. And I've had chronic pain for 12 years. If it hasn't gone after 12 years, there's no likelihood that it's going to go. Right?
Yeah, absolutely.
This for me, when I get up in the morning, I just think, what can I do? And this gives me my purpose every day. And this is what people with chronic illnesses, we lose our purpose, we lose our identity, we lose who we once were. And if we can have something that allows us to be better and stronger, if we can be better or stronger, right? If we can be more included, our mental health will be better, and that will drive our physical health to be better too. So 100%. There's benefits all around.
there are so many different ways to tackle health inequalities, and this is one of them. So, Robert, I want to say thank you very much for your time today. I think I'll do a follow-up with you after this, and maybe we'll see how I can help you, if I can. Yeah, I'd love to.
Look, you know, for me, this is... Sorry, I have a medication that I have to take. Just 1 second.
Don't worry.
That's my wife. She looks after me very, very well.
Very good.
I don't see this as a Robert thing, because it's not a Robert thing. I just happen to be the person who put their hand up and said we need to make the change, but the change cannot come without the support of all those communities, and we all need to work together to drive this forward. I don't have an ownership of it because this is bigger than me. I just feel that I'm lucky in the people that I've met along my journey. I'm lucky in the life that I've had beforehand that gives me the ability to stand up and ask for these changes, but it's not a one-person thing. This actually takes a community to do.
Yeah. Yeah. No, I appreciate that. And that's a really good way to end it. And we'll follow up and then follow your journey. And yeah, all the best, Robert. Thank you very much for your time today.
And thank you for giving me the opportunity to share the story, Ashish.